Good afternoon, everyone. My name is Marimirofa. I'll be presenting on my abstract title, Knowledge, Attitudes, and Practices on Contraceptive Use Among Young People in Selected Universities in Zimbabwe. The study was conducted in 2019. There was a gap between high sexual activity and contraceptive use among students in tertiary institutions. Therefore, this gap is yet to be holistically determined across all institutions. There was also anecdotal evidence from researches by other civil society organizations in the country, which indicates that unwanted pregnancies, unsafe abortions, and STIs have become major reproductive health concerns among students in tertiary institutions. Therefore, this study was conducted to assess the knowledge, attitude, and practices, as well as to understand the sexual behavior, knowledge, and use of contraceptives among young people in these selected universities in Zimbabwe. We also wanted to determine the health systems related challenges affecting access to and utilization of contraceptives among young people. The study was a cross-sectional using both quantitative and qualitative research approach. 4 universities were purposefully selected in the country, while key informant interviews, focus group discussions, and structured interviews were conducted. Desk reviews were conducted also on national documents to triangulate the results of this study with other national surveys conducted before. The median age of the respondents was found to be 21 years. 95% of the students were never married, while 33% of the students had spent less than a year at the institution, with 25% having spent more than 3 years at the institutions. Sexual experience was found to be increasing with age from 15.7% among the age group 18 to 19 years to 63% among the age group 20 to 24. The median age at first intercourse was found to be 20, with 8.8% of the respondents highlighting that they had first sexual intercourse at the age ranging between 12 to 17 years. Contraception use was also high among the age group 22 to 24 years, with those in the same age group ever used contraception. Only 7% in the age group 18 to 19% had used contraception before. There was also high use of emergency contraception in the age group 22 to 24, with 42% of the respondents highlighting that they had ever used emergency contraception. 35% of the respondents had used 2 to 3 times emergency contraception 6 months prior to the survey. 95% of the respondents highlighted that condom is a dual protection method for both pregnancy and STIs, including HIV and AIDS. Most female students also highlighted that they had a perception that men do discontinue condom use sometimes during sexual intercourse. 3% of the respondents highlighted that there were other traditional methods which were being used to prevent STIs and pregnancy. 66% of the respondents highlighted that they were using contraception for spacing and delaying having children. About knowledge on contraception, there was high knowledge across all institutions, with 100% of the respondents from Midland State University know about contraceptives. However, students highlighted that lecturers do not bother to teach about contraceptives, although some do teach during the orientation to new students on health and life skills. Students know most about the pill, with 85% of the respondents knowing about the pill, 82% know about the condom. The least methods known by the respondents were the permanent methods, tubal ligation and vasectomy. 13% also know about other traditional methods used as method of contraception. 68% of the respondents highlighted that they started to know about contraceptives during their secondary education. There was also an attitude towards those who were using contraception, the young unmarried young women in tertiary institutions. 67% of the respondents highlighted that those young women are very responsible, while 30% highlighted that those who are using contraception who are not yet married are very promiscuous. Orals, injectables, and condoms were the only methods highlighted by students that were found in health facilities within the institutions. Hence, there were no method mix or a choice for students. The type of condom also found within the institutions was not preferred by the students. Students were preferring to use emergency contraception, although they highlighted that it was not really available within the college clinics. There was also fear of parents, friends, and discrimination. These were major concerns of young women and men not using contraception. Students also highlighted that some contraceptives were being sold at exorbitant prices. However, this was outside the health facilities within the institutions. For those who were being provided with the health institutions, 50% of the students highlighted that it was very acceptable as they were being offered for free. Side effects, lack of knowledge, as well as religion were highlighted as some of the barriers to contraceptive use by young women and men in tertiary institutions. In conclusion, our study unearthed that increased awareness does not translate to increased uptake of services if the students are not well informed on the benefits of the family planning services. There is also need to motivate young people for effective and appropriate use of contraceptives as to arrest the upward trends in unplanned pregnancy and STIs and HIV. There is need to understand the challenges young people encounter which hinder them from accessing contraceptives. Thank you.